Welcome to Health Journey. As we enter our 40s and 50s, our bodies begin to whisper messages we can't ignore. Our health becomes more critical as we age, especially between 40 and 60. Why? Because these are the years when many chronic conditions start to show up. Think of your body as a car that's been on the road for a while. It's still running great, but it needs more regular tune-ups. Just as you wouldn't ignore a strange noise in your engine, you shouldn't brush off new aches or changes in your body. During these years, we're often juggling multiple responsibilities. We might be at the peak of our careers, raising teenagers, or caring for aging parents. It's easy to put our own health on the back burner. But here's the thing, taking care of ourselves isn't selfish, it's necessary. In this video, we'll explore some common health issues that can crop up between 40 and 60. So let's dive in and learn how to keep our bodies running smoothly for years to come. Cardiovascular diseases are like uninvited guests that can show up as we age. They're often called silent killers because they can develop without us noticing. The three main culprits we need to watch out for are coronary artery disease, stroke, and hypertension. Coronary artery disease happens when the arteries that supply blood to our heart become narrow or blocked. Symptoms can include chest pain, shortness of breath, or feeling tired easily. But sometimes there are no symptoms at all until a heart attack occurs. That's why regular checkups are so important. Stroke occurs when blood flow to part of the brain is blocked or when a blood vessel in the brain bursts. Signs of a stroke can come on suddenly and include numbness or weakness on one side of the body, trouble speaking, or severe headache. Remember the acronym FAST: face drooping, arm weakness, speech difficulty, time to call emergency services. Hypertension, or high blood pressure, is often called the silent killer because it usually has no symptoms. Over time, high blood pressure can damage your heart, blood vessels, and other organs. Eating a healthy diet, exercising regularly, managing stress, and limiting alcohol can all help keep your blood pressure in check. As we move into our 40s and 50s, our bodies can start to have trouble processing the energy we take in. This can lead to metabolic conditions like type 2 diabetes and metabolic syndrome. Type 2 diabetes is becoming increasingly common. It happens when our bodies can't use insulin properly to manage blood sugar levels. Imagine insulin as a key that unlocks cells to let sugar in. In type 2 diabetes, either the key doesn't work well or there aren't enough keys. This leads to high blood sugar, which can damage various parts of our body over time. Symptoms can include increased thirst, frequent urination, blurred vision, and slow-healing wounds. Metabolic syndrome is a cluster of conditions that occur together, increasing your risk of heart disease, stroke, and type 2 diabetes. These conditions include high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. The good news is that metabolic syndrome can often be reversed with lifestyle changes. Eating a balanced diet rich in fruits, vegetables, and whole grains can help. Regular exercise is also key. Aim for at least 30 minutes of moderate activity most days of the week. It's never too late to start making positive changes for your health. As we journey through our 40s and 50s, our bodies might start to creak and groan a bit more. Musculoskeletal problems become more common, and three that often show up are osteoarthritis, chronic back pain, and carpal tunnel syndrome. Osteoarthritis is the most common form of arthritis. It's like the tread wearing off your tires. The protective cartilage on the ends of your bones wears down over time. This can cause pain, stiffness, and swelling in your joints, especially in the hands, knees, hips, and spine. Chronic back pain is another unwelcome guest that often arrives in midlife. This can be caused by various factors, including poor posture, lack of exercise, being overweight, or injuries. The key to managing chronic back pain often lies in a combination of exercise, good posture, and sometimes physical therapy. Carpal tunnel syndrome is a condition that can sneak up on us, especially if we spend a lot of time typing or doing repetitive hand movements. It occurs when the median nerve, which runs from your forearm into your hand, becomes pressed or squeezed at the wrist. Symptoms can include numbness, tingling, or weakness in the hand and wrist. Using ergonomic equipment, taking frequent breaks, and doing hand exercises can help prevent or manage this condition. Section 5. Reproductive health issues. Changes in our most intimate functions. As we navigate through our 40s and 50s, our reproductive systems start to go through some significant changes. For women, this often means dealing with menopause-related symptoms. For men, issues like erectile dysfunction may become more common. For women, menopause is a natural part of aging that typically occurs between ages 45 and 55. The ovaries gradually produce less estrogen, leading to the end of menstrual periods. But this transition, called perimenopause, can bring a host of symptoms. Hot flashes, night sweats, mood swings, and vaginal dryness are common. Men may start to experience issues with erectile dysfunction as they age. ED is the inability to get or maintain an erection firm enough for sexual intercourse. This can be caused by various factors, including reduced testosterone levels, cardiovascular issues, diabetes, or certain medications. For both men and women, these reproductive health changes can have emotional impacts as well. Open communication with partners and healthcare providers can help. There are many treatment options available, from lifestyle changes to medications to therapy. Section 6. Cancer. Understanding the big C in midlife. As we enter our 40s and 50s, the word cancer often looms larger in our health concerns. While it's true that the risk of certain cancers increases with age, it's important to remember that many cancers are treatable when caught early. In this section, we'll focus on 3 common types of cancer that become more prevalent in midlife: breast cancer, prostate cancer, and colorectal cancer. Breast cancer is the most common cancer in women worldwide. It occurs when cells in the breast grow out of control. Regular mammograms are recommended for women starting at age 40 or 50, depending on individual risk factors. Prostate cancer is the most common cancer in men, aside from skin cancer. The prostate is a small gland in men that produces seminal fluid. Prostate cancer occurs when cells in the prostate gland start to grow uncontrollably. Screening typically involves a blood test called a PSA test and a digital rectal exam. Colorectal cancer starts in the colon or rectum. This type of cancer often begins as small, non-cancerous clumps of cells called polyps that form on the inside of the colon. Regular screening, which typically starts at age 45 for people at average risk, can help detect colorectal cancer early when it's most treatable. Section 7. Mental health, the often overlooked aspect of aging. As we navigate the waters of midlife, it's not just our bodies that undergo changes. Our minds do too. Mental health issues like depression, anxiety, and stress can become more prevalent during our 40s and 50s. Depression in midlife can sneak up on us. It's more than just feeling sad or going through a rough patch. Symptoms can include persistent sadness, loss of interest in activities you once enjoyed, changes in sleep or appetite, and feelings of worthlessness. Midlife depression can be triggered by various factors, including hormonal changes, life transitions like children leaving home, or health issues. Anxiety is another mental health issue that can rear its head in midlife. You might find yourself fretting more about health, finances, or the future. Physical symptoms can include restlessness, difficulty concentrating, and sleep problems. Stress is a normal part of life, but chronic stress can take a toll on both our mental and physical health. In midlife, we often juggle multiple responsibilities: careers, family, aging parents, which can lead to feeling overwhelmed. Therapy, whether individual or group, can provide valuable tools for coping with depression, anxiety, and stress. Lifestyle changes can also make a big difference. Regular exercise, a healthy diet, and good sleep habits can all boost mental health. Remember, seeking help for mental health issues is a sign of strength, not weakness. Section 8. The Eyes Have It Vision Changes in Midlife. As we cruise into our 40s and 50s, many of us start to notice changes in our vision. It's like our eyes are playing tricks on us, making us hold menus at arm's length or squint at our smartphone screens. These changes are a normal part of aging, but understanding them can help us maintain good eye health and clear vision throughout midlife and beyond. One of the most common vision changes in midlife is presbyopia. This is the gradual loss of your eye's ability to focus on close objects. It's like your eye's autofocus feature is getting a bit sluggish. You might find yourself holding books or your phone farther away to read them clearly. This usually starts around age 40 and continues to progress until about age 65. The good news is that presbyopia is easily corrected with reading glasses, bifocals, or multifocal contact lenses. Some people opt for monovision correction, where one eye is corrected for distance and the other for near vision. Please like, subscribe, and share. Until next time, stay healthy and happy in your life journey.